Welcome to the Maternity Mentor. Today we will be talking about postpartum incontinence and what you can do to prevent this troublesome condition. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Postpartum incontinence is a very common condition that women never talk about. Let's explore what postpartum incontinence is and how to treat it. Postpartum incontinence is when you pee or leak urine without your control. It may also be called urinary incontinence. Unfortunately, postpartum incontinence is relatively common, affecting 40% or 4 in 10 women. Yet we don't talk about it due to embarrassment and social stigma. It's very important to contact your healthcare provider if you're experiencing symptoms of postpartum incontinence so they can start treatment right away. Fortunately, most treatments are highly effective and non-invasive. There is more than one type of incontinence, but postpartum women tend to experience stress incontinence the most. Stress incontinence is when body movements or activity puts pressure or stress on the bladder, causing you to leak urine. Laughing, sneezing, jumping, and coughing are just a few examples of things that can trigger leaking of urine. This is because the muscles controlling the sphincter or valve at the bottom of your bladder weaken during pregnancy. This valve is responsible for holding urine inside. When it weakens, it can open slightly, allowing for urine to pass out involuntarily. In addition, as the uterus shrinks back down to normal size after delivery, it places additional pressure on the bladder, which adds to the problem. Another factor is the relaxation that occurs to the pelvic region to allow the passage of your baby through the birth canal. This also affects bladder sphincter tone and adds to the problem. Many women believe if they opt for a cesarean section delivery, this will eliminate the risk of developing postpartum incontinence. This is a false assumption. While women who have a vaginal delivery may be at increased risk, up to 50% of women who have had a cesarean section delivery may experience postpartum incontinence. There are many risk factors that predispose women to experiencing postpartum incontinence. These include smoking, hormonal changes, family history of postpartum incontinence, obesity, high BMI, women who maintain weight gain from prior pregnancy into their current pregnancy, urine leakage during the first and second trimester, vaginal delivery, prolonged labor, having an episiotomy or vaginal tear, having a forceps delivery, damage to the nerves that control the pelvic floor including bladder and rectum, and movement of the urethra and bladder from their normal position. For more information on episiotomies and vaginal tears during delivery, please see our video on this. We will link that in the description below. And before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about treatment of postpartum incontinence. There are many treatment options that can be utilized to treat postpartum incontinence. The first recommendation is changing your lifestyle to address the risk factors that have contributed to the development of postpartum incontinence. These same changes can also be used to prevent incontinence from occurring in the first place. For starters, if you are smoking, try to quit. Smoking contributes to postpartum incontinence in 2 ways. It increases bladder spasms and causes coughing, which raises the risk of urine leakage. If you need help quitting, contact your healthcare provider and they will set you up with resources to accomplish this goal for your health and the health of your baby. Another change is getting to a healthy weight through weight loss and exercise. The less you weigh, the less pressure that is being placed on your bladder. Healthy diet includes lots of fruits and vegetables, which can be very beneficial. You should avoid refined sugar, caffeine, coffee, citrus, and spicy foods because they can irritate the bladder. Be sure to drink 8 glasses of water per day, which helps our bodies function better in general. This can also help prevent dehydration and UTIs. For more information on UTIs, please see our video on this. We will link that in the description below. Kegel exercises are a pelvic floor exercise. Kegel exercises are when you relax and contract your pelvic floor muscles. This helps to strengthen all these muscles, which assists in bladder control. Kegel exercises can be done on a daily basis. Performing Kegel exercises before and during pregnancy may prevent postpartum incontinence. You can do them in the car, while making dinner, or after you go to the bathroom. Basically, whenever and wherever is convenient for you. You want to contract the muscles and hold them for 10 seconds before relaxing. Ideally, you will do 30 of these Kegels at one time, which is called a set. Try to do 3 sets of 30 per day. If you need assistance with learning how to do these exercises, as well as an evaluation to determine if further pelvic floor therapy may be needed, your healthcare provider can give you a referral to see a pelvic floor physical therapist. Many healthcare providers will recommend that you schedule times to use the bathroom if you are experiencing postpartum incontinence. This involves creating a schedule where you urinate every 30 minutes whether you feel the need to use the bathroom or not. Normally, we urinate every 2 to 3 hours, but a full bladder increases pressure, raising the risk of urine leakage. By urinating more frequently, the bladder remains empty most of the time, decreasing urine leakage. After a set period of time, your healthcare provider will recommend you start increasing the time between urinating until you're back to your normal frequency. Emptying your bladder prior to activities known to cause urine leakage is also helpful. As part of this process, your provider may discuss the importance of maintaining regular bowel movements and avoiding constipation. Constipation can cause straining, which places pressure on the bladder and the pelvic floor muscles, contributing to the overall issues. When non-invasive methods are ineffective, there are more aggressive options available. A non-surgical option is percutaneous tibial nerve stimulator, or PTNS treatments. During this treatment, a provider will insert a small needle into the tibial nerve near your ankle. The needle sends electrical impulses up the nerve to the sacral nerves that control the bladder. This treatment can help block incorrect signals that are contributing to postpartum incontinence. Your healthcare provider may also offer to insert a vaginal pessary. This is a device that is inserted into the vagina to support vaginal tissues, the bladder, and the rectum. It is used for urinary incontinence as well as pelvic organ prolapse. Finally, there are surgical options such as a vaginal sling, which may be offered if all other options have failed. Surgical options are usually recommended after you've decided to stop having any more children. If you're experiencing symptoms of postpartum incontinence, it's important to speak to your healthcare provider right away. There are other conditions that may look like incontinence, so your healthcare provider needs to rule those out. If they determine you do have postpartum incontinence, they can help develop an effective treatment plan so you can get back to normal faster. While treatment is being started, remember, there are wonderful products over the counter that you can buy to assist with symptoms, namely bladder control pads. These are very similar to menstrual pads. You can wear them in your underwear and they will absorb any urine you leak. Change them as needed and no one will ever know that you're wearing them. Tampons should not be used until all postpartum bleeding has stopped, and they will not catch or absorb urine, so avoid them. Everyone says that recovering from childbirth takes 6 weeks. In reality, your body needs 6 to 12 months to heal. Postpartum incontinence may take 3 to 6 months to resolve, which can feel like a lifetime, but actually falls in line with normal postpartum recovery. Starting treatment quickly can speed up this process. Postpartum incontinence is a common condition that can easily be treated. I hope this has explained how to treat postpartum incontinence and why it's so important to contact your healthcare provider if you think you are experiencing this condition. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family, and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.